Hi, I'm Dr. Johnny. Thanks for joining me for Raji's Quickie. I'm talking rosacea today. I'm going to show you a picture or video of my favorite treatment for rosacea. Rosacea takes on many forms. It's troubling for people. It's the reds on the face, the flushing. It can be acne. Let's get into it. A Raji's Quickie. Within 3 minutes, I'll tell you and show you the treatment being done of my favorite rosacea treatment. 3 seconds. Okay, so remember, if you like these videos, click like. It helps our algorithm here. It helps me out, helps me produce more of these videos on skincare, injectables, lasers, and everything to do with aesthetics. Also, when you subscribe, there's a little bell. If you click it, you'll be notified of all the upcoming great videos that you can watch to keep your skin beautiful. Now, rosacea, I get asked a lot, what's my favorite treatment? Rosacea, most people know it. Between 30 and 50, they start to see more reds on their face. It can be just a little bit, it can be dramatic. There's several types of rosacea. Today I'm talking about the age-related, where people just notice, hey, I have a glass of wine and all of a sudden I turn red. I use my skincare and I'm red for a while. Why is it? Often seen in skin types 1 to 3, lighter colored people, because the white contrasts the red so much and it's troubling. So there's many treatments out there, from medications to topicals to antibiotics, and you have to know which form it is first. But in the form we're talking about today, in terms of topicals, a lot of people follow a strict regimen because when they skew off of that, they get more red. So you want a basic cleanser. You don't want a lot of active ingredients. Cetaphil is often used. My cleanser does well with people. It's pH neutral, so people do well with it. When you go into skincare, on my video on affordable skincare, I separate into kind of actives and inactives, where that's not totally true, but the more actives, when you watch that video, the more not everyone will tolerate it. What do I mean? I'll go through a couple skincare treatments because I know topicals are on your mind. Then I'm going to show you my favorite one. But real quick, a lot of people aren't going to tolerate retinoic acid. However, it will make some people better. You start slow if you're going to use it, and you increase up. That would be an active. An inactive I included in there would be more like the vitamin C. Now, a lot of people are not going to tolerate a vitamin C, especially mine, because it's a 20% fresh vitamin C. A great vitamin C from the people who make VI Peel, they're going to be, and I'll put that one up here, and you can see it. That's going to be tolerated well, has a great base. Most people will tolerate that C. And if you're using a C like mine, you can always make it half strength by mixing it with something else. A great one is hyaluronic acid. So those are two common things that people are on, but be mindful. Don't start a lot of different products. Don't start a lot of actives such as retinoids or tretinoins unless the trend is good and your skin is getting better. But the treatment today, my favorite by far, is IPL, or intense pulse light. A lot of people think lasers. IPL is actually broad-based light. We put filters in it to target what? Browns is common, solar spots, brown spots. We can target hair, of course, for hair removal, but in this case, it's vascular. Those superficial vascular areas on the face, sometimes they take the form of acne, sometimes they're raised, sometimes they thicken the skin. Sometimes you don't see anything until you get an irritant on your skin. Either way, the IPL Intense Pulse Light with a filter in the 500 range. So in the, say, 530, I have a filter, would be good for red spots, the target vessels. Now, a couple tricks with an IPL. IPL is an IPL is an IPL. Just like I talk about threads, a thread isn't a thread isn't a thread. They're very different threads, and it's how it's used. Imagine taking an IPL, you're targeting reds, and the person doing it pushes down hard. All the blood flows away. You flash the IPL, and what happens? There's no blood there for it to pick up, so it's ineffective. So how it's done is important, and you want to make sure that your technician knows If you're targeting vascular areas, don't push in hard. These treatments, you'll hear people say in the comments, "So I did an IPL, it didn't work." For one, maybe you did one, maybe the technician, maybe the type of device. I like a Viora device, that's what I use. There's many out there. People who use their device love it, will get to know it well, but technique is important. So the 530 will get vascular and some browns. A lot of times for people that come into a clinic like mine, they want browns, they want a little bit of skin tightening. If you do enough IPL, you'll get skin tightening. They'll want an overall glow, better skin. They want everything basically. And then you go to a 580 or an SR skin rejuvenation handpiece. So if you're just seeing some reds, but you're going in and you want to have a nice treatment that's going to target a lot of things up towards a 580 wavelength, now we're going to get several things, including skin rejuvenation. We're going to get a lot of it. So for a lot of people, if you're just seeing some reds, you can just get a rejuvenating IPL in that range. But again, the user is going to be specific. Lighter skin is going to be easier to treat. Darker skin's harder to treat, although these devices do a good job. Understand your practitioner might go slow. You need several treatments. And keep in mind, like everything minimally invasive or non-surgical, you're going to want to do 3 or 4 of these a year. Yes, with your chemical peels, with your neuromodulators, with your threads, with your fillers. It all works together. But for rosacea, you know my favorite treatment. Keep your skincare basic. Don't use irritants. Stay with what you know works. Half strengthen until you move up. And IPL, for me, for my patients, is the ticket overall to reduce rosacea. In the comments, really important, I want to know what's worked for you, what do you like, join my channel, subscribe, stay tuned, keep your skin and body beautiful, healthy, and vibrant.